Hello, this is Nicole Ring, and I am a student at Indiana State University in the LPN to BSN program. This presentation is about childhood injury and prevention and is specifically intended for parents of young children. After watching this presentation, viewers should be able to accomplish 5 specific learning objectives. They should be able to identify the 6 leading causes of childhood injury. They should be able to list 4 ways to create a safe sleep space for infants. They should be able to identify 5 ways to prevent drowning. They should be able to list 7 poison prevention tips. And they should be able to identify 7 ways to prevent fires. Please stop here and take the pretest to assess your knowledge about childhood injury and prevention by clicking the link at the beginning of this YouTube video. Injury is an under-recognized public health problem. Approximately 20 children die every day from a preventable injury, which is more than die from all diseases combined. In the United States, unintentional injuries are the leading cause of morbidity and mortality among children. Even though many injuries are preventable, in the United States, 1 child dies from an injury every hour. Approximately 1 in 5 child deaths is due to injury, and a child is treated for an injury in the emergency department every 4 seconds. The leading causes of child unintentional injury include motor vehicle crashes, suffocation, drowning, poisoning, fires, and falls. In the United States, motor vehicle crashes are a leading cause of death, killing over 100 people every single day. Buckling children in age and size appropriate car seats, booster seats, and seat belts reduces the risk of serious and fatal injuries due to motor vehicle crashes by up to 80%. CDC provides guidance to parents to ensure children are properly buckled in a car seat, booster seat, or seat belt, whichever is appropriate for their age, height, and weight. Children should be buckled in a rear-facing car seat with a harness from birth until ages 2 to 4 years old. Children should be kept rear-facing as long as possible. Never place a rear-facing car seat in the front seat. When children outgrow their rear-facing car seat, and until at least age 5, they should be buckled in a forward-facing car seat with a harness. When children outgrow their forward-facing car seat, they should be buckled in a booster seat until the seatbelt fits properly. A seatbelt fits properly when the lap belt is across the upper thighs and the shoulder belt is across the center of the shoulder and chest. Children can usually use a seatbelt without a booster seat around 9 to 12 years of age. Children 12 and under should never sit in the front seat. Suffocation deaths are most common among infants less than 1 year old. There are about 3,400 sleep-related deaths yearly among infants in the United States. Safe sleep strategies can reduce suffocation deaths. Ways to create a safe sleep area for infants include placing infants on their backs when sleeping, using a firm, flat sleep surface covered only by a fitted sheet. Until 1 year old, infants should sleep in the same room as their parents. And soft bedding, such as blankets, pillows, bumper pads, and soft toys, should be kept out of an infant's sleep area. Drowning is the leading cause of injury death for children ages 1 to 4 years old. There are an estimated 3,960 fatal unintentional drowning deaths yearly, averaging approximately 11 drowning deaths per day. For every child who dies from drowning, another 8 receive emergency department care for non-fatal drowning. A child can drown in seconds, and it often happens silently. To prevent children from drowning, they should be taught basic water safety skills and swimming lessons as early as year 1. Pool fences are the most effective and proven way to prevent children from drowning. Door and gate alarms can be equipped with touchpads to let adults pass through without setting them off. An adult should provide constant and close supervision when children are in or near water. Life jackets should be worn by children when in or near water. Parents, caregivers, and pool owners should know CPR. Children younger than 6 years of age comprise approximately 43% of poison exposures. Cosmetics and personal care products are the most common substances to cause poisoning in children, and pain medications are the most frequent cause of child fatalities reported to poison control. In case of child poisoning, parents should be prepared by keeping the poison control telephone number in their phones. Hazardous household items should be locked up, kept in child restraint packaging, or out of reach from children. Household products and medications should be kept in their original containers. Household products should be stored in a different spot than food and medicine. Carbon monoxide alarms should be installed in every sleeping area of the home. Medication labels should be read carefully, and instructions should be followed exactly as the label states. 3 out of 5 home fire deaths result from fires in homes without working smoke alarms. If there is a fire in your home, you could have less than 2 minutes to get out safely once the smoke alarm sounds. Installing sprinklers and smoke alarms in your home increases your chance of surviving a fire by more than 82%. Compared to older children, children ages 4 and under have a greater risk of dying in a fire. Some children are curious about fire. Ways to help keep them safe from fire and burns include making a home fire escape plan and practicing it at least twice a year with your children. Having a fire escape plan for young children who cannot get out by themselves, and discussing who will help each child get out safely. Teaching children what to do when they hear a smoke alarm and there is no adult around, and help them practice getting to an outside meeting place. Teaching children to never go back inside a burning building. Keeping children 3 feet away from anything that can get hot. Keeping smoking materials locked up in a high place, and never playing with lighters or matches around your children. Each year, emergency departments treat more than 200,000 children ages 14 and younger for playground-related injuries. Bumps and bruises will happen, but more serious injuries from falls should be avoided. Ways to prevent child fall injuries include installation of window guards and stops, keeping children from climbing near windows, securing children when they are seated, playing on soft surfaces at playgrounds, wearing head protection, watching out for the stairs, and using of safety gates, preventing TV and furniture tip-overs, and use of anti-slip rugs and mats. Parents, healthcare providers, teachers, and neighbors can take steps to prevent child injury where children live, learn, and play. Please stop here and take the POST test to assess your knowledge about childhood injury and prevention by clicking the link at the beginning of this YouTube video. For access to this flyer, click the link at the beginning of this YouTube video. Here is a list of the references I used to make this presentation. Thanks for listening, and I hope you enjoyed.